I worked for the #1 psychiatric hospital in the US, and I specialize in diagnoses and was consulting on international diagnoses for a period of time. So let's talk about what diagnosis is and what it isn't, starting with the DSM. Here's the truth. The DSM was created by white cis males, right? And things like homosexuality were in the DSM as a diagnosis, a mental health condition, until 1973. We still have hysteria, okay, in the DSM, which is certainly misogynistic in and of itself and was often historically used and directed towards women specifically. However, there is a place and space for diagnoses, but let's understand why and how, okay? In our current system in the US, diagnoses drive treatment and the ability for people to obtain treatment. In order for your insurance to cover any sort of treatment, you have to have a diagnosis in place. That requires clinicians to diagnose you with something. But let's understand the DSM and let's understand what the diagnoses are. It is a very imperfect system. We know that we are all very unique beings, okay? So the purpose of diagnoses is to figure out where people best fit, what diagnoses best fits them, because ultimately based on the diagnoses, that directs treatment. Unfortunately, by insurance companies, which is a problem in our system, but it also directs treatment in terms of what interventions are chosen. There are certain interventions that are specialized for certain people. For example, cognitive behavioral therapy is a treatment that's evidence-based for people that have depression, for example. DBT, dialectical behavioral therapy, is an evidence-based treatment for those who have borderline personality disorder, right? So depending on what diagnosis somebody has, there's a treatment plan or treatment interventions that follow along with that. But it's really important to have differential diagnoses. You know, it's not the best when people just slap on a diagnosis, and often that takes time, understanding people's patterns, longitudinal engagement with somebody, definitely review a past history, getting collateral information from other people. And at the same time, our systems that are in current place don't always allow for that deep dive. Now, at the same time, I could put more ownership and more responsibility, although there's already such burnout in the field of mental health, but on the clinicians to actually gather and do their due diligence before making diagnoses.